Hello to all my dear aspirants. Welcome you all to Sail to MDS Dental Academy. I am Dr. Malay, pediatric dentist and assistant professor in College of Dental Sciences. So aspirants, today we are here with the part 2 as our promise with the NEET MDS 2020 paper. So those students who have missed part 1 can view by clicking on the I button above, and also the link is given in the description box. And aspirant, please try to give your 10 minutes to this video, because along with the questions I am explaining few important concepts also that can be a question in your coming examination. So let's start with the 21st question. So which is a major site of exchange of ions from saliva in the salivary gland? So it is the striated duct. Remember aspirants, whenever the saliva is getting secreted, it is isotonic in nature, and as it passes through the acini and the duct, it is converted into hypotonic. So whatever saliva you get in the mouth, it is hypotonic in nature. So when your saliva is primarily secreted, consists of ptyalin, mucus and extracellular fluid, and when it passes from the lumen through the ductal system, it is getting modified. And most of the modification take place in the striated duct, where ion exchange takes place, converting them from isotonic to hypotonic solution. Remember, whatever the absorption take place, that is sodium, it is active in nature, chloride is passive, and potassium active secretion takes place along with carbonate ions. Now experience setting reaction for zinc phosphate. For that, the critical component is water, but among the available option, the aluminum is the most important. Why? Because whenever the powder is mixed with the liquid, the phosphoric acid attacks the surface of particles, releases zinc ions into the liquid aluminum, which form a complex with the phosphoric acid known as zinc aluminophosphate gel. And remember aspirant, this is a reaction for zinc phosphate. It is exothermic in nature. That's a zinc oxide react with phosphoric acid, forming zinc phosphate and water. Then experience a case report. A medically compromised 46-year-old female patient got her molar tooth extracted under local anesthesia. Subsequently, she developed fever, respiratory distress and swelling in the submandibular region. So what's the diagnosis? It is the classical feature for Ludwig's angina. Remember aspirant, this is a small review for Ludwig's angina. The etiology for that is dental infection and bad oral hygiene along with suppurative lymphadenopathy. It can cause pain, fever, toothache, that's odenophagia, stridor, submental and submandibular swelling. Most often treatment we go for medical, that's antibiotics, anti-inflammatory and oral antiseptic gargles. And in surgical we go for the incision and drainage of abscess. Then experience the children of a mother who frequently took alcohol during pregnancy will have what pathology? They have a microcephaly. Please note the symptom of microcephaly. There is a seizures, small head size, coordination difficulties, dwarfism or short stature, backward sloping of forehead, hyperactivity, facial distortion, delay in speech and movement. Now, which maxillary tooth erupts by 10 to 11 years of age? It is maxillary first premolar. Please aspirant know the eruption age for all the teeth. For central incisor it is 7 to 8 years, lateral 8 to 9 years, canine 11 to 12 years, first premolar 10 to 11 years, second premolar 10 to 12 years, molar 6 to 7 years, second molar 12 to 13 years, third molar 17 to 21 years. For lower arch, central incisor 6 to 7 years, followed by lateral 7 to 8 years, canine 9 to 10 years, first premolar 10 to 12, second premolar 11 to 12, first molar 6 to 7, second molar 11 to 13 and third molar 17 to 21 years. Then aspirants will focus on another question about TLD. So it works on the principle of conversion of radiation upon heating. Remember aspirant, TLD is a thermoluminescence dose meter. It's a primary form of personal radiation monitoring dosimeter. Thermoluminescence is the eminence of light by heat, and TLD measures ionizing radiation exposure by measuring the amount of visible light emitted from a crystal in the detector when the crystal is heated. Then aspirant will go with another question. A case report, a 5-year-old patient presents with a root stump of tooth 7-5 which is painful. So what's the treatment? Treatment is extract 7-5 under local anesthesia, followed by distal shoe space maintainer. Remember the another name for distal shoe, that is intra-alveolar appliance. It is used to maintain the space of primary second molar that has been lost before the eruption of permanent first molar. It was introduced by Willett, which is a bar type gingival extension, and the Roche appliance have V-shaped gingival extension. And one more important point for distal shoe aspirant, remember the gingival extension should be about 1 to 1.5 mm below the mesial marginal ridge of molar. Then aspirant, another case report, a 10-year-old child with skeletal deep bite, mandibular retrognathism, horizontal growth pattern. So how you are going to treat it? With the functional appliance. Remember, functional appliance is also known as myofunctional appliance. They are used for growth modification procedure that are aimed at intercepting and treating jaw discrepancy. We have a removable and fixed type, that's activated bionator, fixed, Herbst appliance, and Jasper jumper. Remember in exam they ask which is the most commonly used functional appliance, that is twin block. Then another case report, a patient has a dry eyes, dry skin and dry mouth. So it depicts Sjogren syndrome. So what drug should be administered for the relief of condition? So you can give CV-meline. It is a parasympathomimetic and muscarinin agonist with a particular effect on M1 and M3 receptor. Most commonly used in the treatment of dry mouth, especially associated with Sjogren syndrome. Then which of the following is an antioxidant vitamin, that is tocopherol. And please aspirants note the synonyms for all your vital amines. Then best material for orbital floor reconstruction, that is Calvaria graft. Then HPV, that is human papillomavirus, is associated with cervical cancer. Then aspirant, a case report, a 59-year-old lady patient report with a bilateral peripheral loss of sensation and tingling in both the legs. There is also altered touch perception and loss of deep tendon reflex in the affected limb bilaterally. So here the cause is diabetic neuropathy. Then during excess cavity preparation for endo treatment, if there is an incomplete removal of pulpal floor is done, the type of problem you can see in excess preparation is mouse hole preparation. So you can see in this diagram, this is mouse hole preparation because of incomplete extension of axial wall. Then aspirant, another case report. So a 69-year-old male with symptoms of headache, pain and swelling in the temporal region. And histopathology shows granulomatous inflammation of temporal artery. So treatment of the condition is prednisolone 40 mg once daily. It is the beautiful drug, a corticosteroid in such condition in which the patient condition improves rapidly within 1 to 3 days. Then remember aspirant, the dilated pupillae and constricted pupillae muscles of eye are derived from neuroectoderm. Then what is relative stiffness of a material within the stress and strain curve? That is elastic modulus. Then aspirant, cough is a side effect of which of the following drugs? That is ACE inhibitors. The common side effect of ACE inhibitor is cough. We'll focus on important point in ACE inhibitor, that is ACE inhibitor share a common suffix, that is april. Medical use of ACE inhibitors, you can remember this mnemonic: home care makes patient definitely strong. So H for hypertension, C for congestive heart failure, M for myocardial infarction, P for prophylaxis of CV risk subject, D for diabetic neuropathy, and S for scleroderma crescit. For side effect, you remember the mnemonics captopril, C for cough, A for allergic reaction, P for potassium elevation, proteinuria, T for test change, O for edema, P for photosensitivity, R for renal failure, I for indigestion, and L for low blood pressure. Then addition silicone of palladium is done in aqueous elastomeric impression material to improve the property. If you are not adding palladium, what will happen? A pinpoint voids in stone cast occur if it is poured immediately. Remember aspirant, addition silicone is also known as polyvinyl silicone impression material, commonly used for final impression and bite registration. The ratio is the equal amount of base and catalyst paste is taken. For important point for addition silicone, remember it is available in different form like light, medium, heavy body. It is highly accurate, easy to spatulate, odor free, tends to bubble on setting, and latex gloves may inhibit set. That's why we have to use vinyl or nitrile gloves. Then aspirin substance approved to be used as scaffold by the FDA, that is polyglycolide. So aspirin, that was all from part 2. See you tomorrow with the part 3, and any of you require the latest papers and last minute revision notes, you can message me. And we are starting new batch from 20 December. So new students want to join, they can approach me. And many of you are asking about image based question. So you can click on the I button given above, as well as the information is given in description box. A 6 set videos are there of the image based question that can be helpful for your examination. So till then, aspirant, keep on working hard. Days are very less for examination. All the best to you, and see you with part 3 tomorrow.